My name is McKinney, and I'm one of the co-founders of Bit Cortex, as well as a PhD candidate in cognitive neuroscience. And today I'm absolutely thrilled to be sharing with you some of the things that Bit Cortex has been doing in the goal of gamifying mental health assessments with a refined focus on burnout prediction. And this is as part of our larger vision for seeing a world where people are engaged in cultivating their mental health and well-being, armed with personal insight. And our approach is largely based on my research, as I mentioned. So, so it's probably no surprise that mental health is a really big problem right now. Since the pandemic began, an estimated 38% of Canadians have had a drop in their mental health, which is overall just not a good situation to find ourselves in as a collective society. It's putting a lot of strain on all of us. But we've recently identified through the customer discovery process that there's a group of people who are struggling even more, and that's the doctors, that's the physicians, the people who are keeping us safe and healthy over the course of this pandemic are the ones that are having some of the largest degrees of mental health strain as a result of the increased demands on their time and expertise. And unfortunately, this is not a recent problem. A study from 2016 found that 78% of physicians were reporting high degrees of burnout. So while this has been a long-standing problem, COVID-19 has really just exacerbated the issue. And unfortunately, I don't see it necessarily calming down extensively once COVID-19 starts to wrap up. It was long-standing. It's likely can continue to be a problem moving forward. So we need a solution to this. So we're developing a platform right now that specifically can actually measure the individual components of burnout, which is theoretically defined as chronic stress, impaired attention, and a sense of cynicism or lack of trust within your fellow colleagues. So right now, if a physician wanted to get a psychological assessment, they would first have to go through a fairly extensive wait time process that's not the most conducive to their schedule. They'd have to block out several hours, which if you've looked at the doctor's schedule, may or may not be feasible. So what we're trying to do instead is to gamify the process and basically break it up into small little bite-sized chunks where somebody would log in, they would play a short micro game, answer some questions about their current mood and the recent activities. And they would do this once a day over the course of a couple weeks. And this, first of all, makes the assessment process much more manageable for them to incorporate into their schedule. But it also has the added benefit of allowing us to look at patterns in the data across time. I previously published a paper in a peer-reviewed journal on this microburst approach to doing cognitive assessment and found that this can produce a lot more unique insight that isn't gathered through traditional assessment approaches because we're not looking at a snapshot in time so much as looking at patterns across time that are much more prognostic. And we think that there's a huge opportunity if we can effectively solve this problem through technology. The cognitive assessment market was estimated to be around $8 billion, but that was pre-COVID. With growing appreciation and acceptance of telemedicine, we can expect that this is even larger, which is reflected in the compound annual growth rate of the telemedicine sector of 32%. And additionally, the cost of absenteeism within the workplace due to burnout and other mental health challenges is estimated to be $9 billion within Canada, even larger if you consider the American market. So there's a real financial incentive for employers to be using our technology to help identify when people are at risk for burnout and be proactively providing them with the resources before they need to take a costly leave of absence. We ran some quick numbers, and if we were able to charge a $20 a month subscription to physicians for our burnout notification system, and we're able to capture just 10% of the physicians within Canada, this would be a $2.1 million yearly revenue. And if we're able to expand in the American market and capture the over 1 million physicians south of the border, this expands up to 26 million. So there's quite a bit of opportunity if we're able to effectively tackle this problem. As I mentioned, we didn't actually initially set out to be tackling physician burnout. So this is a more recent pivot for refining our platform towards this goal. We think that our unique selling point is the fact that we're using automated and gamified assessments. The gamification makes these assessments actually somewhat fun and engaging for them to do, in contrast to the otherwise boring approach that's typically done. And then by automating it, we don't have to waste any critical manpower within our healthcare system to actually administer these assessments. They just kind of go on going. And then with our theory-based analytics, we'd be able to provide much more nuanced information about physicians' overall well-being and provide them with provide them with notifications when they're at risk for subsequent decline much sooner than conventional approaches. So then that way they can be connected with the resources and support necessary to get through their challenging time without needing to take a costly leave of absence or otherwise have to have some sort of turnover within the workplace. With respect to our IP strategy, as a software solution, we actually wouldn't initially be eligible for patents. So we'd be going the trade secret and algorithm route. However, once we do have a validated burnout prediction model, we do believe that itself can be patented. So we'll be looking into that. Eventually, we would like to license our technology as a medical device, so that way physicians could use it not only for managing their own mental health, but also those of their patients as well. So from the very beginning, we're designing our platform with privacy and security in mind, so that it'll be compliant with HIPAA, GDPR, IAH, and PAIDA as the gold standard legislative requirements that we need to meet to operate in the healthcare space. I think perhaps the biggest reality check that we've had over the process since we started this about a year ago is exactly how time and labor and capital intensive this app development process is. We came together with our prototype in just a few weeks, and we were very proud of that. However, the process of going from prototype to MVP has taken several months, as you can see from some of these screenshots from our more recent beta test to be launched. We've been fortunate, though, in that we've received a wage subsidy grant to be able to hire one of our developers full time, which has actually helped quite a bit for us being able to accelerate our process. With respect to our business model, we want to initially return to our social enterprise roots and launch a freemium version of the platform for all individuals with that burnout prediction as a premium membership. Because ultimately, at the end of the day, if we're not able to collect the data that we need from people, we're not able to predict anything. So the success of this enterprise is really predicated on that really good user experience where people want to use our platform for tracking their own mental health. And then we can use that as the foundation in a staged approach for then transition to being a plug and play solution for health insurance providers, where we can identify the doctors that are at risk for burnout and proactively link them up with their insurance benefits. So that way they can get the support necessary to go through their challenging times. And then this will then provide the foundation necessary for getting licensed as a Class 2 software medical device from Health Canada and the FDA, so we'd be able to operate within the healthcare space as well. While the ideas presented so far are largely based off my own research, I could not have done this alone. It wasn't until I met my co-founder, Shannon, that we're able to take these research ideas and transform them into a feasible business plan, which we were then able to work with our developers, Eden and Raz, in developing that prototype and now our soon to be launched MVP, really making our vision a reality. And then most recently, we've been able to bring on Dr. Frank McMaster at the University of Calgary in an advisory role to help us out with the clinical validation study. And we've been really fortunate to have a lot of support from the broader community. Since June of 2020, we've been able to raise about $50,000 in non-dilutive funding from various partners, being able to do some pre-MVP consulting in order to build our brand and awareness with the key strategic partners. And of course, we want to acknowledge our university collaborators and other people who have been able to provide us various forms of in-kind support while we're kind of working on a bootstrap shoestring budget. Thinking about our future steps, we initially want to do a beta test in May for our new UX, and then follow that up with a more formal human factors and clinical validation studies in June and July 2020. And both those studies would be going on in parallel concurrently, leading towards an end user launch in September 2020. And then in the fall, we'd like to begin applying for the necessary regulatory approval to be a Class 2 medical device within Canada. Overall, at this stage, we're looking for beta testers as we start to look at how our new UX performs. And as well, we're interested in particular if anyone has any guidance on how we can start to develop our end user agreements with clinicians to really make sure that we're addressing their specific needs and where there might otherwise be inefficiencies within the delivery of mental health services. And together, I believe that we can really empower people to take back control over their mental wellness and give them a sense of agency. So with that said, thank you very much for listening to me speak. And on that note, I will take questions.